Hi, I'm Dr. Akila and I'm a consultant obstetrician gynecologist and a fertility specialist practicing at Fertility IVF Clinics, BTM Layout, Bangalore. So today in this video, I'll be talking about when do you need to consult a fertility specialist. If you're unable to conceive after 1 year of regular and unprotected intercourse, then it's high time for you to come and consult a doctor. Why do we take this 1 year as a duration? Because 85% of the couples conceive by end of 1 year, whereas 15% of the couples face problem in conceiving. Do all the couples need to wait for 1 year to consult a doctor? Not really. There are few factors which should be taken into consideration. So first, age of the female partner. When age of the female partner is less than 35 years, then she can try naturally for 1 year. But if her age is more than 35 years, then she need to report and consult a doctor within 6 months of trying. But if her age is more than 40, then immediate reporting should be done. The second are menstrual cycles. If her periods are irregular, either it may be delayed, like once in 2 to 3 months if she's getting a period, or if it is frequent, like once in 25 days if she's getting a period, or if her flow is less, or if her flow is heavy, then there is some kind of hormonal imbalance which is going on in her body, which should get evaluated. And the third one is if already known case of PCOS, that is polycystic ovary syndrome, and diminished ovarian reserve, and if it's a case of endometriosis, and if any kind of tubal pathology is there, then again she need to report immediately. If any surgeries was undergone on the ovaries, then also this will lead to decline in the ovarian reserve, so that woman should come and visit a doctor. And the next one is if she is a known case of cancer, so where chemotherapy or radiotherapy is required as a treatment for her, then her fertility should be preserved before chemo or radiation, either by egg freezing or embryo freezing if she is married. But if it's a man with cancer, then his fertility also can be preserved by doing semen freezing. At least 6 to 8 samples of semen are frozen in the laboratory for the later use. And the next one is if she's having any genetic conditions, any problems with the genetic, then also she need to report to the hospital. And if any kind of sexual dysfunction either in women or men, like if women is facing any vaginismus or any painful intercourse, or if in men if any erection, ejaculation problems and difficulty in penetration, so then also he should come and visit a doctor. And lastly, which is more important, is recurrent pregnancy loss. If more than 2 pregnancy losses in the past, where that should be evaluated either by sending the embryos for testing, which we call it as PGTA, which can be done only through IVF. So IVF will be done and then we form the embryos in the laboratory and we send these embryos for pre-implantation genetic test. And before that, I want to say even few general conditions like thyroid or any prolactin abnormalities, if any diabetes in women and even in men also will affect his or her fertility. So to conclude, first thumb rule is patience. If after 1 year of trying, if she's unable to become pregnant, then she need to report. But if any of the above factors that I've mentioned is there, then she need to report immediately. Thank you.